Today's video is another controversial topic known as patient abandonment. What exactly is that? It's when a clinician says that they can't do anything more for you and doesn't refer you to other specialists or clinicians who may be able to help you. Now, there can be a number of reasons for that. One is that the clinician involved doesn't have much empathy for your situation. So that's one, and one will question whether they're in the right profession if that's the case. Secondly, that they're not aware of the other specialists that may be required to assist you, and whether that's a medical specialist or an allied health profession. So whether it's for orthotic inserts or for some sort of a splinting device, or if it's a neurology opinion for a neurological condition, or a rheumatologist or an endocrinologist. So there is an onus on the clinician to have some understanding about other potential pathologies that need to be explored if the patient isn't responding to, in our case, physiotherapy. So and obviously with the expansion in different services being available, sometimes that's it's not possible to be fully au fait with every conceivable option, but there are general categories which an astute clinician should be aware of and have some indication as to whether there's any merit in going down that route of exploration. The other, of course, elephant in the room is that they don't refer on or basically abandon a patient because they're concerned about commercial implications, or that they're trying to extract more appointments rather than making a rational clinical decision at a period of time after a number of treatments. If somebody is plateauing in their response to treatment, that some other evaluation or investigation may be required, and that decision can be clouded by commercial interest rather than patient welfare. So there can be a number of factors required, but really any astute clinician both has a professional obligation and a moral obligation to be aware of the spectrum of services that may be available to a patient, but also to make decisions as to whether they think they're likely to be helpful. And obviously that's a decision that you as a clinician have to have with the patient. Now, patient abandonment is not the same thing as telling somebody that they have reached the limit of their capacity. And we would see a lot of patients with chronic persistent problems where you're trying to maximize their function to the best of your ability and their potential capacity. And when that point of plateau occurs, sometimes people aren't happy with that level of impairment, if you like, but you as a clinician have to make a call. Well, is this as good as it gets? And if this is as good as it gets, well, people mightn't be satisfied with it. If you make that call, essentially you need to say, look, I don't think there's any other potential, no matter what other specialties or other kind of services are brought to bear upon this. And that should be an open decision and discussion you have with patients. From a practical point of view, clinically, we are often in a situation where somebody maybe wants to be able to go running and they have a degenerate knee, and they try to do their 10k or half marathon and it just keeps flaring up, and it might be a case then of just paring that back to a 5k, which is may not be what they want to do, but if it's a difference between being able to run to some degree without further damaging the joint, and obviously proper clinical examination can tell us whether the joint's reacting badly to the level of loading. Sometimes it's really only by exploring those boundaries that you can determine, okay, well, this is an acceptable level that your system can tolerate without flaring it. Now you will get some people who don't really care and will just live for the moment and pay the price, but obviously that will come to an abrupt end if they just keep ploughing into activities that aggravate degenerate joints and just flare them up. Then eventually the system just says can't do any more, and that's the difference between controlled exposure to a load that's stressful on the system but manageable, as opposed to a controlled load on the system that just flares things up and breaks them down. But oftentimes the clinician is trying to push the boundaries of people's capacity and explore things, and it usually comes down to hitting a bit of a barrier where you try and achieve more in terms of walking or running or lifting or bending or whatever the region that's involved is, and you just hit a glass ceiling, if you like, and usually with that kind of strategy, the patients will sort of recognize, okay, we've been very systematic in our approach, we've tried to move through varying levels of progression, and we've reached a maximum. Now, sometimes that's a little bit of a gray area, and when you reach that brick wall, you can reassess and say, okay, well, maybe we need to look at orthotics, maybe we need to look at different footwear, maybe we need to look at splinting or bracing in a damaged area, maybe so those are thoughts that can come up in conversation if you reach these roadblocks. But in chronic conditions, you invariably will reach some point of limitation where the system says, I can't take any more of that. And then really from a clinical point of view, people have reached their capacity, and then the objective is to try to keep them functioning at that level as well as you can for as long as possible. So yeah, and obviously, for you to be able to say that to a patient, they need to have confidence that you've come to that conclusion from systematically analysing and targeting the various clinical aspects that you find in examination, and that your treatment strategies have been as good as they can be. If you tell somebody, well, that's as good as you're going to get, and they don't really feel that you've explored many options or that you've really pushed the boat out, well, then you really will lose a little bit of credibility. So obviously, for you to be able to make that decision, which isn't a comfortable thing, like telling somebody that this is the limit of their capacity, that takes a bit of gumption, and it's not always a nice conversation. Sometimes it's a shock to people that they may not realize the degree of change that the tissues have undergone over time. Sometimes people have already come to that conclusion anyway. So it's very much a horses for courses kind of scenario. But that's a conversation that often doesn't happen clinically, because obviously everybody wants to try and make people 100% better, and a lot of conditions, that is the case, but there's an awful lot of conditions out there where you're trying to maximize potential to the best possibility, but realizing that there are limitations, and it's only by exploring the boundaries that you can reach that conclusion. And if you've been through that in the systematic process, and that you've been honest and open in your discussions with people, then usually people can come to some degree of acceptance that whilst it mightn't be ideal, that is the limit of their capacity. But if you just come to an abrupt end in treatment and say, all right, that's it, end of story, can't do anything more for you, and nothing more that can be done, then the way that message is delivered often causes friction, and patients then go off searching for other solutions. And obviously information isn't in short supply these days, so there's any amount of rabbit holes that people can go down in terms of exploring options. But it's really, as a clinician, your job is to provide an overview so that you can at least direct people as to what category of care massage may be, or acupuncture may be, or reflexology, and otherwise they just end up going through a whole plethora of different things with limited potential to improve if they've reached that point in their rehab program. So it's not a commonly talked about subject, but I thought it was one that was worth sharing with you, and I hope you found some of that information beneficial. I'll see you again on another video. Bye for now.